it's Dr. Ev, and this is a holistic approach to what to do if you wake up and you have like a kink in your neck. You slept wrong, you are having a really hard time turning, your range of motion is limited, and you don't really know what you did because you just woke up like this, right? So in this video, I'm going to walk through a couple of things that might have contributed to this happening. And then I'm going to give you some practical tips and tools to do if you ever find yourself in this acute situation. Full disclosure, this just happened to me. I am freshly coming through an episode of this. So I'm gonna just kind of try to break it down to see if some of these tools and tips might apply to you. Now, of course, if you're having any severe headaches, any blurry vision, you have nerve pain running down the arms, if there's anything really severe going on, then hold still, and that is more of an emergency situation where you would just want to go straight to your doctor's office and skip this video for now. But for most of us, when we wake up and we're just really sore in our neck and we're like, what the heck happened? This is for you. First, let me talk about some of the things that I think when this happened to me. First rule, try not to panic, okay? Pain equals sensation plus fear. So the more that we are afraid and the more that we panic, the more pain that we can experience, okay? So trying to stay calm is the best thing that you can do. Then it's very common to think, what the heck did I do to myself? Or what happened to me? What I really want you to understand is it's usually a combination of things. For me, I'll give you my personal example. When I thought about it, it was for sure that I slept poorly. My daughter came in the night and I was really hot and restless, and I had to pick her up and bring her back to bed. I do think I did sleep in a really compromised position on my shoulder. I also had a couple of glasses of wine the night before. I know that that can really challenge my nervous system's ability to adapt and heal. And then I had done a little bit more of a shoulder intensive workout the day before. So maybe I had stressed my system, didn't give it its time to adapt, added that extra challenge, and bang, that was the straw that broke the camel's back, so to speak. So really think about it in a cumulative effect. You don't have to fear or avoid that pillow or that one specific thing once you're through this. Like, it's not the enemy, throw it all away, I'm gonna throw away my whole bed and get a new bed. It's that sometimes we're able to adapt to challenges more and sometimes we're not, and there's cumulative variables that come into play in a situation like this. So I find that really good to know, and I really help my patients kind of understand that it's not just one thing. Then the next big thing is to just observe with a very neutral lens. So it's almost as if you're the doctor now and you're also the patient and you're just kind of trying to assess what is going on. So maybe you do some basic ranges of motion with your head. Oh, it hurts more to turn to the left for me, still a little bit. What about tilting to the side? Ooh, yeah, it pinches when I move towards it. What about looking down? What about looking up? Ooh, yeah, in the back there, it pinches. And then trying to just kind of see. And then I moved my shoulders because our shoulders are connected to our neck and a lot of times they're involved. Now, usually when we get into these acute situations, it's a multi-layer issue going on, right? Our muscles are kind of our body's big henchmen. They are the movers and shakers of the body, so to speak. So our muscles come into play and they get tight, and that is their job. Their job is to stabilize, to help, to support, to, if the body thinks that it needs to shut down the motion of an area, the muscles will do that job very beautifully. But the muscles can also be what causes the sensation of pain or discomfort or stiffness, right? So I know my muscles are probably involved. Where does it start? Where might start to release this thing? And so I start feeling around, and I use a tennis ball to help me kind of figure out where this was going, because I can't touch every part of my back or body, right? But I can kind of suss around with a tennis ball or a foam roller or something. I was able to sort of locate some key target tender areas. Felt like they were part of the problem. All of this is information. We're not panicking when we're finding this out. We're not going, oh my gosh, this is the worst. Oh my God, what's happening to me? Like this is never gonna get better. Any of those thoughts, just, they're not part of your vocabulary. Once I figured out where the target zone was, I really just did what I could to see how my body was gonna tolerate release. So first I started with an anti-inflammatory, like topical. And I love Arnica as far as a plant-based anti-inflammatory. I used some Arnica gel on like the sore, tender areas of my neck. Then I started to try to just move and flow and see what ranges of motion felt good, okay? So hanging my head felt good, letting my arms dangle felt really good, things like that. So you could try this. You could just see and pause and what feels good, what feels like it helps. Then I started to dig around a little bit with a tennis ball, with a Theragun, with some of my myofascial tools. And I actually noticed that my body reacted poorly to that. And then I used KT tape on my neck because that's what I do. Arnica, KT tape, those are kind of my number one acute care tools. So I put on some tape just to help stabilize, bring blood flow, help with the fascia support, give my nervous system that little bit of compression and mechanoreception that our bodies tend to crave when we are in acute pain. And then the things that helped a ton that you also should be doing, of course, I worked on hydrating. I knew that I had, drank wine the night before. That is already pretty dehydrating. And then I was just like clean eating, nothing inflammatory, no sugar, and I drank a ton of water. I also took magnesium lactate, which is great for tight muscles. So basically making sure that you're just staying super hydrated, not only with water, but also with minerals, because our muscles really need minerals in order to relax. Now, if I didn't have to go to work, then I might have just let myself rest. Maybe I would have taken a Epsom salt bath. Maybe I would have laid with some ice on my neck to help just kind of ease the pain a little bit, and let myself ease. I did have to go to work, and I discovered that holding my neck, moving my neck was making things a lot worse. So this is really interesting because sometimes movement helps people move through things, and sometimes movement makes things pissed off. And so how do you know what it needs when? So there are two kind of types of movement that you can think about in this category. One is directed movement, where I would actively be trying to do movements with my neck and get my neck to move. Then there are secondary movements that use your neck, but in a very passive and connected way. So like something like this, where my neck is actually stable, but my body is moving around my neck and the muscles are having to react and respond, is was tolerable. So if I was going like this, oh no, but this feels really good. So I was like, okay, I'm gonna move, then I would be wanting to move some. I felt like walking was really gonna be what did it for me. So I got adjusted as soon as possible. I reached out to a few colleagues in my area and got on the schedule ASAP. It helps to have a friend in the biz, if you know what I mean. And I was like, help me. That movement really did help me restore some motion, but it also just helped my body, again, reiterate the message that I'm safe, that my body's not broken, that there is nothing acutely damaged, that it was just kind of the perfect storm. And then throughout these last couple of days, as I've been continuing to recover, I've just continued to start adding more movement gradually, still listening to my body, but also kind of trying to challenge myself a little bit more. Okay, at this point in the video, you might be asking about pain relief medication and or anti-inflammatory NSAIDs. And as a chiropractor, I'm not allowed to recommend or prescribe any sort of pharmaceutical product. And one of the things that I think that you should consider if you do decide to embark on an over-the-counter journey is that when we are taking an anti-inflammatory or a pain suppressant, we're making it so that our body is less able to sense what is going on. I 100% do not recommend taking a medication so that you can ignore your body and just push through. So I want you to start thinking about deeply recovering so that this isn't something that happens to you again in 6 more months. This is how those chronic patterns happen, is we don't fully recover, we mask symptoms, and then we still have issues and we never get the problem actually treated. I really think that it's useful when I know that I'm gonna be resting, I know that I'm gonna be sleeping, I know that I'm gonna be just taking it easy anyway, then it's like, okay, why would I be in pain while I'm trying to do that? But if I was going to go to work, for example, which I did have to do, I really didn't want to aggravate anything worse. So I wanted to be able to feel what different things I was doing at work were doing to my body so that I could modify my behavior and my actions and some of my adjustments and things like that. And so I decided not to take anything that would alter my ability to sense my body. Day 4, the pattern is shifting. Now it's coming back to where it truly started to originate, which is great because now I can work on this area more and I am able to see the pattern a little bit more clearly as my body continues to heal and integrate and work through this. Do not talk badly about your body. Literally ever. There's no reason ever to say a bad thing about your body, ever. Your body is doing what it thinks it needs to do to protect you, and maybe that's not the most comfortable for you right now. And if it helps, find 5 things that are great about your body, 5 things that you appreciate about your body. Say thank you to your body. Say thank you, neck, for trying to protect me from whatever it is that you think that you needed to protect me from. I'm sorry that I overloaded you. I'm here now. I'm listening. Let's work through this together. Okay? Say it with me. I did want to put it out there because this is something that happens to the best of us. It is definitely a conundrum. It's definitely a mystery. It sometimes doesn't feel like it makes any sense. But when we take a look at really what our lives it's really just showing us that we're in a more vulnerable place, that we're a little bit vulnerable to stress right now. And so the things that we can do moving forward are things to help us build more resilience and to reduce our allostatic load a little bit so that our bodies can adapt to the challenges and continue to be our best partners in this life. So as always, I hope that helps you.